We would like to welcome you to watch the ABC and Ds of Medicare. The question is, how does Medicare work? We would like to share a short video that helps give a great overview of Medicare before going into detail.
When you're first getting started with Medicare, there can be a lot to learn and consider, and it might seem overwhelming. Let's start at the beginning with the ABCs and D of Medicare. Medicare includes parts that are the building blocks of your health and drug coverage: Part A, Part B, and Part D. And there's also Medicare Advantage, sometimes known as Medicare Part C. Let's start with Medicare Part A. Medicare Part A is sometimes called hospital insurance. It covers hospital care, like inpatient care at a hospital, skilled nursing facility care, hospice care, and some home health care. Usually, you don't need to pay a monthly premium for Part A. Medicare Part B, or medical insurance, covers services like certain doctor visits, outpatient care, medical equipment like wheelchairs, and preventive services like flu shots. With Part B, you'll pay a premium every month. In many cases, if you don't sign up when you're first eligible, you'll have to pay a late enrollment penalty, which is added to the monthly premium cost for as long as you have Part B. That can add up, so it's important to pay attention to your deadlines. Medicare Part A and Part B are both under what's called Original Medicare. If you want drug coverage too, then you can join a separate Medicare Part D plan. Medicare Part D coverage is provided by private companies that you can choose from. For a Medicare Part D plan, you'll pay a monthly premium that depends on the plan. Remember to consider your plan options when you're first eligible to avoid late enrollment penalties. And finally, there's Medicare Advantage, also known as Medicare Part C. Medicare Advantage plans are another way to get your Medicare Part A and Part B coverage. These are Medicare-approved plans offered by private companies that bundle your Part A and Part B coverage, and usually include Part D drug coverage too. Most plans include extra benefits like vision, hearing, dental, and more.
How does Medicare work? Generally, you only need to sign up for Part A and Part B once. After Medicare is set up, each year you can choose which way to get your health coverage and add or switch drug coverage. Medicare is different from private insurance. It doesn't offer plans for couples or families. You don't have to make the same choice as your spouse. Let's talk about steps to setting up your Medicare coverage. If you're currently collecting Social Security, the Social Security Administration will automatically enroll you into Medicare, and you will receive your Medicare card about 105 days in advance of the first of the month that you turn 65. If you don't collect Social Security for whatever reason, you will need to apply for Medicare Part A, which is the hospital insurance, and Medicare Part B, which is the medical insurance. If you don't collect Social Security, you can sign up for Medicare 3 months before the first of the month you turn 65. For example, if your birthday was January the 10th, you could sign up online for Medicare October the 1st. Our agency has assisted thousands of people to sign up for Medicare and has accomplished this through the Social Security website. You can apply for Medicare yourself, which, if accomplished, would take about 30 to 45 minutes. If you choose to utilize our assistance and have previously applied for a My Social Security account online, it takes less than 10 minutes to complete. You will choose the way you want to receive your Medicare benefits. Utilizing Original Medicare as a benefit payer is often compared to having a PPO plan. People who receive their Medicare this way will also have to decide on a Medicare supplement, sometimes referred to as a Medigap policy, as well as enrolling in Part D prescription drug program. We assist you in the Medicare website to determine which plan is the best to cover the medications that you are on. You can also choose to enroll in a Medicare Advantage plan. These plans are network-driven plans and are predominantly paid for by Medicare and are insured through private health insurance companies. You will have You will have Original Medicare unless you join a Medicare Advantage plan. How does Original Medicare work? Original Medicare covers most, but not all of the costs for approved health care services and supplies. After you meet your deductible, you pay your share of costs for services and supplies as you get them, and there's no limit on what you'll pay in out-of-pocket in a year unless you have other coverage like Medigap, Medicaid, or employee union coverage. Services covered by Medicare must be medically necessary. Medicare also covers many preventative services like shots and screenings. If you go to a doctor or other health care provider that accepts Medicare approved amount, your share of cost may be less. If you get a service that Medicare does not cover, you pay the full cost. With Original Medicare, you can go to any doctor or hospital that takes Medicare anywhere in the United States. It's recommended that you ask the provider if they accept Medicare as a direct payer. Almost all providers accept Medicare as a first payer or direct payer, and the only major medical group that we know that doesn't accept Medicare as a first payer would be Kaiser Permanente Medical Group. Then you must join a separate Medicare drug plan known as Part D to get the drug coverage. As previously mentioned, we can help you find the Part D plan that will best work with the prescriptions that you are taking. And then you can buy, and we can assist you with this, buying a Medicare supplement plan known as a Medigap policy to help lower your share of costs for services you get. You may have heard plans like these. For example, there are Plan Gs or Plan Ns. There are several other varieties. If you have other insurance, we can teach you what would make sense for your present situation. There are also many factors to consider. If you're not lawfully present in the United States, Medicare won't pay for Part A and Part B claims, and you can't enroll in a Medicare Advantage or a Medicare drug plan. Feel free to stop the video and to look at the material on this page, which includes Part A, hospital premium, and what deductible and coinsurance is for Part A, hospital coverage, as well as Part B premiums and what Part B deductible and coinsurances are. Most Part C plans come with no premium or very little premium. Part D premium is based on the plan that you want, and higher income individuals may be asked to pay a higher premium. This page shows the increased cost for Part B for high income individuals. Please note that the premiums for Part B premiums are based on yearly income in 2023, and the look back on your income is 2021. This premium is also adjusted yearly by the federal government. There's also a premium adjustment for Part D that's not illustrated here. Most people will fall into the threshold that will require them to pay a minimum premium for Part B, which is $164.90. There are also certain situations for low-income people where they might not pay a Part B premium. We're happy to assist you to understand your situation. So how does Medicare Advantage work? Medicare Advantage bundles your Part A, Part B, and usually Part D coverage into one plan. Plans may offer extra benefits that Original Medicare doesn't cover, like vision and hearing and dental and other services. You might hear advertisements with celebrities like Joe Namath who describe all the benefits he says you deserve. These commercials often discuss all the benefits offered by these plans, but neglect to tell you that there is no one plan that offers all the benefits they discuss. We can help you find the plan that allows you to keep your physicians that you want and cover your prescriptions the best. For extra benefits, we assist you with the plan that matches your objectives. You join a plan offered by a Medicare-approved private insurance company that follows the rules that are set by Medicare. Each plan can have different rules for how you get services, like needing referrals for a specialist. Costs for monthly premiums and services you get vary depending on which plan you join. Plans must cover all emergency and urgent care, and most medically necessary services that Medicare covers. Some plans tailor their benefit packages to offer additional benefits to treat specific conditions. With Medicare Advantage, you need to use the doctors that are in the plan's network, except in emergency or urgent care, for which you can see any doctor or any provider. You may pay a premium for this plan in addition to the monthly Part B premiums. Plans have a $0 premium or may help you pay for all of the Part B premiums. You can't buy or use a separate supplemental coverage like Medigap when you're on Medicare Advantage. You must also have both Part A and Part B to join a Medicare Advantage plan. We represent most carriers and the plans that they offer. How does Medicare work with my other insurance? When you have Medicare and other health insurance, like one from your job, one will pay first, called primary payer, and the other will pay second, called the secondary payer. If you have other insurance, who pays first depends on a number of items, like are you still working, the type of insurance you have, and if you have a special situation like end-stage renal disease. We will discuss and help you evaluate whether staying on your group health insurance plan, if you're working beyond age 65, is your best option, or whether choosing a Medicare option will serve your needs better. Your Medicare costs. We've highlighted several of these costs already, but thought it might be a good place for you to review and determine if you need more information. When we call you back after viewing this video, let us know which of these items you would like to have clarified to you. Part D coverage. We've discussed that Part D can be purchased as a standalone benefit and is often purchased along with a Medicare supplement. Part D also comes as a core benefit with most Medicare Advantage plans. The basic mechanics of how Part D works is standardized from the insurance carrier to insurance carrier, as it must follow CMS guidelines. Co-pays, co-insurance, and what drugs are covered under what formulary varies from plan to plan. That is why it's best to seek our services and determine which plan will best serve your needs. We hope that this video has cleared up some of the confusion about Medicare. Unless you're in the Medicare business and have a good understanding of the workings of Medicare, it's important to have somebody that you trust that can guide you through the process. CAP Insurance has been assisting people like you to understand the A, B, C, and Ds of Medicare since 1978. We will walk you down the path from Medicare knowledge to finding you a plan that fits your needs. We can assist you in your current location or as you move throughout the United States. You are welcome to come visit our website at www.medicarewithcap.com or use your telephone and scan the QR code, which will take you right to our website. Or you can also call Craig Prince at 909-717-9735. We look forward to being of service to you. We hope that you will share this video and our name with others who are becoming eligible for Medicare or who already have Medicare.